Hi friends, good evening. I'm Dr. Ashwin Gupta. Today we are going to talk about a macroglossia being a marker for trisomy 21. Okay, so it sounds astonishing. The premise of fetal medicine is to identify all the soft markers for trisomy 21, which is the commonest aneuploidy, right? At level 1. So there is a lot of talk like you do this and that and to identify trisomy 21, right? So what we are talking about today is we are talking about a macroglossia, right? So जब जीभ या टंग बेबी की जॉस के बाहर होती है और continuously irrespective of the lips, then it makes a diagnosis for a macroglossia, right? So macroglossia could be an sporadic isolated finding, and it could be associated with some congenital abnormalities. Down syndrome is definitely one of them. The second one is a Beckwith-Wiedemann. Beckwith-Wiedemann is an hemi-hypertrophy syndrome in which you can have an visceromegaly, you can have some issues with the adrenals, you can have some issues with the kidneys, but the foremost and the most important is an omphalocele. Right, we can have an acromegaly, we can have some intrinsic lesions of the tongue also, like you can have a lingual thyroid, you can have a ranula, you can have some lymphangiomas cross into the tongue, and therefore that makes the tongue protrude outside of the mouth, right? तो कुछ स्लाइड्स हैं जिनके द्वारा मैं आपको समझा देता हूँ कि मैक्रोग्लॉसिया कुड बी अ मार्कर फॉर ट्राइसोमी 21. So look closely here. So this is the baby in a sagittal position. We can identify the tongue, right? So this is protruding outside of the mouth, outside both the lower and the upper jaw, right? So the baby is trying to chew up the tongue, right? So this is the tongue that the protruding outside of the mouth. So this might give you this appearance as if the baby is doing a thumb sucking, right? But see carefully, you can identify that this is the tongue. This is the tongue that the baby. The umbilical cord insertion is normal, so probably we are not dealing with a omphalocele, and there is no congenital diaphragmatic hernia, right? So this is the tongue which is protruding outside of the mouth, and the baby is continuously trying to chew it up. Okay, so ऐसा लगता है कि thumb just adjacent है mouth के, but look closely, the thumb is away just in front of the nose, but it is not in the mouth. Right, so look carefully, and this is the tongue which is being protruding out through the mouth, right? So this is the tongue. Okay, now this baby have had a normal umbilical cord insertion, so that rules out an omphalocele. We never have had the congenital diaphragmatic hernia and no macrosomia. Okay, so Beckwith-Wiedemann is the very least likely diagnosis, and secondly, the fingers were separate out, and therefore it is very unlikely to have an Apert, right? For a Downs, I had been very consistent about this thing, that Downs can be very well missed on an ultrasound. So 1/3 of the Down syndrome babies, they can be absolutely normal on an ultrasound. This might be an isolated finding, macroglossia, and this has been described as an autosomal dominant trait to run into families, but it needs to be investigated on the lines of common aneuploidy, that is for Down syndrome, as Down syndrome is concerned, right? And so macroglossia is being regarded as a soft marker for trisomy 21, and needs further testing so as to confirm or to refute the diagnosis, right? Thank you very much for your patient listening.